I'm Dr. Kelly Starrett, Human Performance Advisor for H-Wave. Today we're talking about a specific use case of how we might use H-Wave to facilitate better outcomes in knee sort of trauma, knee surgery recovery. One of the things that often happens in tissue systems is that when I have swelling or trauma or pain to a system, we see the inability to recruit the musculature around that. Now that seems counterintuitive, that the body would try to splint or sort of downregulate my ability to generate force around a tissue system, but actually it makes kind of good sense. If I have some knee trauma, if I can downregulate, downshift how much force I can produce in the leg, likely I'm going to produce less potential mechanisms of injury or less sort of additional trauma to the knee. Well, that's great if I'm in the wild. It's less great if I need to get my leg working again. So again, after long periods of chronic pain or after surgery or swelling, oftentimes we see inhibition around the tissues. So I'm going to show you a couple ways that we like to use the H-wave for neuromuscular re-education as a way of highlighting these areas in your brain and making it easier to recruit the musculature organically. So what I've got here is just two pads set up. One is on my VMO, one is sort of in the middle of my sort of the mass of my quadriceps. I've set the device on low frequency here. And as I start to turn it up, I'm going to get a good solid muscle contraction going in the leg. Now, I can go massive here, but I just need a muscle contraction. Now, one of the mechanisms of rehab is to try to facilitate decongestion of the tissues. And one of the reasons that we prescribe what are known as quad sets in the rehabilitative setting after knee trauma is to do two things. One, to make sure that we can sort of maintain control of the joint with the quadriceps, which oftentimes gets inhibited. And second, we want to continue to pump and decongest that joint. Remember, that joint is drained by the deep lymphatic system, and all of that is sort of bootstrapped into the musculature. So if I contract the quadriceps, I'm going to get draining around the knee. So all I need to do is turn up the device to begin to initiate a quadricep kind of pump, and then I can do my own set of quadricep pumps along with it. So it's sort of like instead of having to tap on the muscle or really force it, I get some input into this. My brain says, oh, I see what's happening, and oftentimes I can just go for a ride on the back of this pumping motorcycle. So it makes it easier for me to recruit what I need to recruit. I also have an opportunity to use high frequency. And now normally in this setting of high frequency, we're really worried about or we're trying to get some pain relief in between the two pads. So I might be through the joint or specifically kind of in an area where I'm trying to give myself some relief. Again, just between the two pads where I'm going to feel it the most. But in this situation, if I just turn this up, I'm going to get some tetanus. Ultimately, I'm going to cause a muscle contraction to engage. And what's nice about having this universal dial is that I can dial this up before I start to kind of go into tetanus or lockdown, and it makes it easier for me to contract with it. In fact, I can dial it up to get a good solid contraction and then use that as a cue for my own kind of control for this. So again, all I have to do is just give myself a little input. I start to contract, I contract with it and override it, turn it off. So we have two ways about helping these sleepy quads. These quadriceps have been inhibited from my knee pain, knee swelling into coming back online. What's great, of course, is that if you're regularly using the H-wave and being kind of diligent about decongesting this joint system, oftentimes we don't have to lose that neuromuscular connection. Usually that's secondary to a lot of swelling, a lot of pain, and if we can help manage that swelling and keep that congestion down, we have less pain and less quadriceps inhibition in the first place. But oftentimes we get behind and we need to kind of reclaim that function. Again, either low frequency, kind of riding along with it, or high frequency with some specific control. Either way, I can help my brain reconnect to my quadriceps, which is going to be a key aspect of my healing process.